Good morning. I'm Dr. Jansen from the Hutchinson Clinic, and we're here to talk about influenza today. This is the time of year that everybody is interested in getting their flu shots, and everybody's interested in finding out what is influenza. Well, influenza is a respiratory illness. It's caused by influenza virus. It's different than what people typically call flu, stomach flu. That's more of a stomach illness with nausea and vomiting, sometimes with aches and things too. But influenza is more of a respiratory illness. It can be mild in some people and quite severe in others. Those particularly at risk are the elderly and those that are very young. People over 65 and people less than 5, and certainly those less than 2 years of age, are at high risk. Also those with chronic illnesses such as asthma, emphysema, diabetes, heart disease, liver and kidney illnesses, all of those people are at particular high risk also. Flu season typically begins in November, December, and goes into January and February, but it can occur as early as October and goes late as April and May in the spring. Symptoms are those you typically see with viral illnesses. You get runny nose, sore throat, achy, sometimes a little bit of nausea, but primarily fatigue. And the symptoms are similar to that you see with other viral illnesses, just a lot more severe. Complications can be bronchitis and pneumonia and even ear infections. But the largest problem are those people with chronic illnesses that just get exacerbations of those symptoms. Every year people die from influenza. People don't realize that influenza can be a serious problem. Every year, somewhere around 36,000 people in the United States die primarily from influenza, and that's even been up to 65,000 per year. I think it's 90% of people that die from influenza are actually over age 65, so that's why that's one of the highest risk groups. People always ask about side effects from the shot, and the primary side effects are right where the shot is given. A little bit of redness, soreness, sometimes a little bit of swelling. Occasionally people will get a little bit of a low-grade fever and feel achy, and that's really from your body producing antibodies to the influenza virus, and that's what you want to happen. Usually does not last for more than 1 or 2 days. Who should get a flu shot? It's pretty simple today. Anybody over age 6 months should get a flu shot. In the past, you probably remember having people, different age groups. That's primarily for those times when there's a shortage of flu vaccine and we're trying to give it to the people that are at highest risk. But the simple answer today is if you're over 6 months of age, you should have an annual flu shot. As far as being contagious, it's actually contagious from 1 day before you get sick until 5 or 6 days after you're sick. So that's why it's so easily transmitted, is you actually transmit the illness before you actually become ill. So who should not get a flu shot? If you've had a severe allergic reaction either to eggs or to a previous flu shot, you probably should not get it. Or anybody who developed Guillain-Barré syndrome as a result of a flu shot. And those are primarily the primary reasons that you shouldn't get one. Now, remember I said severe reaction. If you get a mild reaction, you need to talk to your physician. It's probably still okay to get a flu shot.
So can the flu shot cause influenza?
No, it cannot. The flu shot is actually a killed virus, so it's not able to grow or to multiply, which would cause an illness. It just gives you get a reaction, like I said earlier, when you develop antibodies. Now, there is a nasal vaccine that actually is an attenuated, which means it's alive, but it can't cause disease. And that actually causes problems primarily in the nose. If it gets inhaled into the respiratory tract, the body temperature actually kills the virus. So it does not cause influenza.